A recent multi-million-dollar grant from the National Institute on Minority Health Disparities is designed to improve newborn health in rural Maine communities.
So the grant will enable MaineHealth to enhance technology used for training clinicians in newborn resuscitation. Rural delivery teams do not get as much practice with resuscitation because of lower birth rates.
The funding will also support the use of what's called augmented reality to make that training feel a little more realistic. News Center Maine's Vivian Lee shows us how.
When you put it on.
At the Hannaford Center for Safety, Innovation, and Simulation at MaineHealth, Allison Zano, a neonatologist at Barbara Bush Children's Hospital, shows us how augmented reality can improve training for newborn resuscitation.
And then when I give breaths, which will also appear on the actual monogram, I can see how the baby responds.
MaineHealth's Hollow Baby technology allows providers to train using augmented reality glasses that add lifelike sights and sounds to a mannequin. They can hear the baby grunting, crying, or having trouble breathing, as well as its heartbeat. Vital signs and EKG readings show up on the holographic monitor that matches the baby's movements. The technology responds right away to what the care team is doing.
The baby can open its eyes and breathe and move, and so as opposed to just a low fidelity mannequin that lies here lifeless.
Rural delivery teams get fewer opportunities to practice these life-saving skills since there are not as many births and training costs more. Because of this, newborns in rural hospitals are 4 times more likely to suffer from birth asphyxia, which can lead to death or serious brain injury than those in urban hospitals.
You need to get oxygen to the brain within minutes.
Dr. Mary Ottolini, the chair of pediatrics at MaineHealth's Barbara Bush Children's Hospital, and her team created Hollow Baby to give rural delivery teams
start chest compressions,
a more affordable way to learn how to resuscitate newborns.
The baby can have a change in tone, it can have a change in color, and it can breathe and do all those things that a real baby can do.
The National Institute on Minority Health and Health Disparities recently gave MaineHealth a 4-year, $2.8 million grant to keep developing Hollow Baby. Dr. Bill Stevenson, a pediatrician at MaineHealth's Penn Bay Hospital, who has used Hollow Baby, says the real-time training is extremely valuable for delivery teams.
You can do all the procedures that you would need to do with a real infant on them. And so you can practice the steps of breathing. You can practice the steps of putting in an artificial airway.
The technology will be utilized in nearly a dozen rural hospitals within the MaineHealth system sometime in the future. In Portland, Vivian Lee, News Center, Maine.
MaineHealth also plans to expand on early research at its rural hospitals, which already showed better teamwork and stronger use of neonatal resuscitation program guidelines.